I'm Dr.N. Upendra Kumar, Senior Consultant Urologist, KIMS Hospital, Secunderabad. Today we would like to discuss about the urinary infections in women. So commonly the urinary infections do occur compared to the males in women because there are few factors. One is the female urinary tract, that is urethra, is very small. It is around 4 centimeters and it is very close to the vagina and the anus. So all these bacteria can attack the urethra and it's easy to get infection in females. And usually females in a year, the normal number of infections they can have is around 2 to 3 per year. If it occurs more than that, we need to go for the proper cause of this because there can be an obstruction or there can be a reflux of the urine which can lead to this type of infection. So we need to go back and evaluate for the urinary infections in females. So how do you know that a female has a urinary infection? Basically, the normal urine infection, which means is the infection of the bladder. It is also called cystitis. Generally, all females suffer from cystitis. The symptoms are, number one is they have frequent urination, they have urgency, they have the sensation of incomplete evacuation. That means when they pass urine, they still feel that there is something need to be emptied again and again. And they have urgency, they can't hold the urine, they have to rush to the bathroom. And sometimes they can have severe bleeding from the urine because if the infection is very heavy, they can have severe blood from the urination. And sometimes they can have high grade fever with chills. These are all a part of urinary infection and they keep getting frequently urination either in the morning or night. So that disturbs their sleep. So these are some of the symptoms of urinary tract infection, that is cystitis, which I told you. And how do you diagnose this? You have to do a complete urine examination which shows you that there are some pus cells, and urine culture will give you exactly what bacteria has caused infection in this, and that we can plan and then give an antibiotic for a period of a week days. Generally this urinary infection subside if it is an uncomplicated. That means, as I said, if there is only a bladder infection, usually it subsides with a week of antibiotics, and patient has to be hygienic. She should not have any constipation and she should take plenty of liquids, at least 2 to 3 liters per day, and preferably cranberry juice and other juices are preventive for infections, urinary infections, so they can take this and have a healthy habits, hygienic habits. So these are some of the things about the normal urinary tract infection in females. And coming to the complicated urinary tract infection, this means the infection which is there in the bladder has spread to the kidneys. That is called acute pyelonephritis. So this acute pyelonephritis, the symptoms are, apart from, as I said, urinary frequency, urgency, burning, lower abdominal pain, they can have severe flank pain or back pain followed by high grade fever with chills. This indicates that the patient has a kidney infection. They sometimes can have severe vomitings also. So these are all the symptoms of acute pyelonephritis which can be diagnosed by means of complete urinary examination, then doing a CT scan which will tell us how much kidney is infected, is there any pus collection in the kidney. So these are important when doing a contrast CT scan. And apart from that, we go for any other cause which is causing this pyelonephritis like diabetes, etc., immunosuppressive conditions which can lead to this type of pyelonephritis. So apart from this, some females, since childbirth, they can have frequent UTIs. That is because of a congenital condition called vesico-ureteric reflux, where the urine goes back into the kidney while passing urine. Normally urine should come out, but for these females, some part of the urine goes front and some part goes into the kidney. This is called vesico-ureteric reflux. If it is a low grade reflux, sometimes it is missed, and that leads to frequent urinary tract infections leading to chronic pyelonephritis. That means kidney gets infected every time, which leads to a scar, and that's how slowly the kidney becomes very small and small. This is called chronic pyelonephritic kidney, and finally the kidney gets damaged and function goes off. So this is the one important thing which needs to be kept in mind, particularly in children, where if they are having frequent infections, you have to rule out this condition called vesico-ureteric reflux, which can be confirmed by means of doing a test called micturating cystourethrogram, where it is an X-ray test where a dye is put into the bladder and a patient is asked to pass urine and X-rays are taken, and you can see exactly how urine is going back into the kidney. So actually, if it is a low grade, we manage conservatively with the medications, antibiotics and medications. If it doesn't respond, we can go for either deflux injection or we can go for a reimplantation surgery. So that will clear this problem. And during pregnancy, a lot of females can have urinary tract infections. That can be because of the hormonal imbalance and reduced fluid intake, and sometimes the kidney presses on the ureters. That can lead to dilatation of the urinary tracts, and that can lead to kidney infections also many times. So even if the pregnant lady, she has to get screened in every 3rd month, 6th month, 9th month, so that if there is any bacteriuria or pyuria, she has to be treated even if she is not symptomatic, because this can affect the baby. So these are some of the important things, and to prevent UTIs, they have to take plenty of water, at least 2 to 3 liters, take plenty of cranberry juice, and they have to maintain clean hygiene. When they are cleaning the genitalia, they have to clean from front to back, and most important, they have to prevent constipation and try to prevent any further problems like diabetes or obesity has to be reduced by doing regular exercises, eating high fiber food. So these are some of the things you can prevent these urinary tract infections. And whenever it is complicated, you need to approach the urologist and take proper treatment so that kidneys are not damaged. Thank you.